Introduction. Welcome, medical students, to today's lecture on the fascinating topic of esophageal histology. In this comprehensive script, we will delve into the intricate details of the histological aspects of the esophagus and its associated pathologies. From the anatomical structure to embryology, from motility disorders to esophageal repair and regeneration, we will explore every aspect of this vital organ's histological characteristics. So let us begin our journey by understanding the basic composition and epithelium of the esophagus. The esophagus is a muscular tube responsible for connecting the pharynx to the stomach. At its most basic level, the esophagus is lined with a specialized stratified squamous epithelium. This type of epithelium consists of multiple layers of cells, designed to provide protection against the mechanical stress associated with swallowing and the passage of food. The basal layer of the epithelium contains proliferating cells that constantly replenish the superficial layers, ensuring the integrity of the esophageal lining. Notably, the esophageal epithelium lacks glands but is constantly exposed to the damaging effects of acid reflux and mechanical abrasion. Moving on, let us shift our focus to the transition zone between the esophagus and the stomach, known as the Gastroesophageal Junction, GEJ. The GEJ is characterized by a specialized epithelium, termed the squamocolumnar junction or the Z-line. This region marks the border between the stratified squamous epithelium of the esophagus and the columnar epithelium of the stomach. It is important to note that any displacement of the GEJ can lead to pathological conditions such as gastroesophageal reflux disease, GERD, or the development of Barrett's esophagus. The muscular layers of the esophagus play a crucial role in facilitating the movement of food from the mouth to the stomach. Disorders affecting esophageal motility can disrupt the normal peristaltic movements required for efficient food movement. Two of the most common esophageal motility disorders are achalasia and diffuse esophageal spasm. Achalasia is characterized by the impaired relaxation of the lower esophageal sphincter, leading to the accumulation of food and subsequent dilation of the esophagus. Diffuse esophageal spasm, on the other hand, results in uncoordinated and ineffective contractions of the esophageal muscles, causing chest pain and difficulty swallowing. Barrett's esophagus is a condition characterized by the metaplastic transformation of the normal squamous epithelium of the esophagus into specialized intestinal-type columnar epithelium with goblet cells. This change is primarily induced by chronic gastroesophageal reflux, where the constant exposure to gastric acid causes cellular damage and triggers a reparative response. Barrett's esophagus is a significant risk factor for the development of esophageal adenocarcinoma, a highly aggressive and lethal form of cancer. Esophageal cancer is a life-threatening disease that arises from the epithelial cells lining the esophagus. The two main types of esophageal cancer are squamous cell carcinoma and adenocarcinoma. Squamous cell carcinoma predominantly affects the upper and middle portions of the esophagus and is often associated with risk factors such as tobacco and alcohol consumption. Adenocarcinoma, on the other hand, is commonly found in the lower esophagus and is closely linked to chronic acid reflux and Barrett's esophagus. Histological examination of esophageal cancer samples reveals invasive malignant cells invading the deeper layers of the esophageal wall. The esophageal submucosa contains numerous mucus-secreting glands known as esophageal glands. These glands secrete mucus, which aids in lubricating the esophageal lining and protecting it from abrasion. The esophageal glands primarily exist in the lower third of the esophagus and are more abundant in individuals suffering from gastroesophageal reflux disease. Esophageal strictures refer to the narrowing of the esophagus due to the gradual development of fibrous scar tissue. This condition can be congenital or acquired, with the latter often caused by chronic inflammation, such as in patients with long-standing acid reflux. The stricture restricts the passage of food, causing dysphagia and discomfort. Histologically, strictures display fibrotic changes, along with inflammation and alterations in the normal epithelial architecture. Esophageal varices are dilated veins in the lower part of the esophagus that result from increased pressure within the portal venous system. Commonly associated with liver cirrhosis, these varices can rupture, leading to severe bleeding. Histologically, esophageal varices exhibit thin walls composed of enlarged, tortuous blood vessels that lack the normal structural integrity. The esophagus is innervated by a complex network of nerves, including both sympathetic and parasympathetic fibers. The sympathetic fibers originate from the thoracic sympathetic ganglia and predominantly regulate esophageal vasoconstriction. Parasympathetic innervation is primarily mediated by the vagus nerve, which regulates peristaltic movements and controls the lower esophageal sphincter's function. During embryonic development, the esophagus arises from the foregut, which is formed as part of the early gastrointestinal system. The esophagus undergoes complex morphological changes to achieve its final structure, including the formation of the muscular layers and the differentiation of the epithelial lining. Errors in embryological development can give rise to various congenital anomalies, such as esophageal atresia or tracheoesophageal fistula. Biopsies of the esophagus serve as a valuable diagnostic tool for evaluating various esophageal pathologies, including suspected malignancies, infectious diseases, and inflammatory conditions. Histological analysis of esophageal biopsies allows for the identification of cellular abnormalities, inflammatory changes, and the presence of pathogenic microorganisms, aiding in accurate diagnosis and appropriate treatment planning. The esophagus possesses a remarkable capacity for repair and regeneration, allowing for the healing of injuries and restoration of normal tissue architecture. This process involves the recruitment of various cellular types, such as fibroblasts and immune cells, along with the deposition of extracellular matrix components. However, severe and prolonged damage, such as in chronic acid reflux or advanced tumors, can overwhelm the regenerative capacity, leading to irreversible structural alterations. In conclusion, the esophagus is a complex organ with fascinating histological features. Understanding its histology is crucial for accurate diagnosis and management of esophageal diseases. This script has provided a comprehensive understanding of esophageal histology for your future medical practice.